Dear friends, welcome to the show Talk with Your Doc. I am Dr. Prashant Jani, and with us is Dr. Steve Klassen. Dr. Steve Klassen is a family physician here in Thunder Bay, Ontario. Today's topic is sleep disorder called as insomnia. Statistics show that more than 40% of the population in Canada is affected with insomnia. And insomnia is not only common in Canada, but it's an epidemic all over the world. Many people are suffering from this sleep disorder, insomnia. Insomnia has tremendous impact on one's health and social life. Hence, it is very important for us to diagnose insomnia at early stage and treat it. It can lead to a serious disorder like hypertension, heart disease, and many other diseases. Dr. Steve Klassen is going to guide us how to diagnose and how to treat the insomnia at the early stage. Thank you, Dr. Klassen, for coming to the show.
Thanks for having me.
Very happy to have you. Please tell us, what is insomnia?
Great. So insomnia, as people experience it, they often think of having trouble going to sleep. But insomnia can be so much more than that. It can also be that a person has trouble with waking up frequently through the night and having difficulty going back to sleep through the night. And then it can also be that a person can wake up early in the morning, well before they're ready to wake up, well before they're rested. And so there's different stages of insomnia.
So insomnia is lack of sleep either for whole night or some part of the night, or
that's
for
correct.
few days, or it can last for the weeks also?
It can be lifelong.
Yeah. So it can be like for a few days acute insomnia, and then it can get cured by itself?
That's absolutely.
And or it can last for whole life probably.
Absolutely. So if there's those that with types of insomnia where right from childhood they've had struggles with sleep.
Oh.
And then others that whether it's a disease process or a medication that has started interfering with their sleep, and it can start out gradually and then over time become a bigger and bigger problem for them. And so often people ignore it for a long time or just suffer without talking with somebody about it because there are solutions.
So they are not able to go to the sleep. It is affecting their life, but they don't approach anybody. Why is that so?
You know, I think in part that there's some misunderstandings around it. One of the most common misunderstandings, and I hope we can tackle this a little bit more and package this later, is that people think that the only way to deal with this is with medication or pills. And fortunately that's not true, but that's one of the things that they worry. If they go to a doctor, they're just going to be given pills. However, there's so many different reasons for insomnia, there's so many different ways to approach insomnia. And so I think if they know that it's not just going to be pills, if they know that there are various approaches to this, that hopefully they'll be more willing to come in to get help.
So you think that people are suffering from this disease, but they don't know that they have a disease?
I think that and most people that have insomnia complain about it, they struggle with it, but they don't know what to do about it. They've just given up. That this is just the way their life is, and they struggle with it, but struggle alone often.
So what do you call insomnia? Like lack of sleep for like few hours or 5 hours or 10 hours, or what is the minimum sleep required, and at what point it becomes insomnia?
Sure, and I think that's a difficult one to nail down for the individual. I think everybody is a bit unique in this. We can talk about that an average night's sleep would be 8 hours ideally, but there are people that can survive very well on less, and there's some that need more sleep. So one of the questions that I like to ask people is, how much sleep do you find that if you get on a regular basis that you actually feel rested in the morning? And that's probably a more valuable answer than nailing it down to a certain amount of sleep. So when a person is feeling that it's affecting their life, that it's affecting their ability to function, when a person is saying, hey, this is causing me problems, that's when there's time for help.
So that is what we call it as insomnia. It is not the number of hours of sleep then probably.
No, I don't think that we needing to count. I mean, one of the classic problems that people have is that they want to count how many hours they've slept, and that's actually counterproductive. So I don't actually encourage people to count how many hours they're not sleeping. When they are getting good sleep, how many, approximately when did they go to bed, approximately when did they get up? That's a useful thing to figure out. But how many hours they're laying awake at night, if they can tell me that, I already know part of the problem.
Okay. So what causes this lack of sleep or insomnia?
So many causes. So for some people that have had it since childhood, we don't necessarily know. Can there be an anxiety disorder or trauma? But for some people, it's not clear. We call this idiopathic insomnia. But then there certainly are all kinds of diseases that add to insomnia. So whether it's actually an anxiety disorder, whether it's depression, whether it's a heart disease, a breathing disorder, sleep apnea, there's so many different diseases that can add to insomnia.
So it can be right from the childhood, which is idiopathic, which we don't know the cause probably, or it can be secondary to other diseases like stress or anxiety, or any other physical disorders can also cause lack of sleep leading to insomnia.
Correct.
So when somebody has this lack of sleep or insomnia, and next day morning they won't feel comfortable or won't feel alert, so it will affect their driving skills or other skills?
Sure. I mean, if you think about, I think everybody can relate to a night or two of not having sleep for one reason or another. Just being a parent is often where you first get your experience with insomnia, right? Certainly, it's you're more irritable, you're less alert, and so we do see that insomnia contributes to accidents, that insomnia contributes to mistakes at work. It can contribute to relationship stress. If you're more irritable, or you're more likely to have arguments, or you're more likely to be intolerant of somebody else. So lack of sleep, we can all relate to.
So in the children, it might affect their academic performances as well, right? Does it have effect on like heart and blood pressure?
Right, and so one of the things that I think we're slowly trying to tease out here is chicken or egg, what diseases are actually caused by insomnia, and we're slowly realizing that sleep is causing all kinds of, is contributing to disorders even like diabetes, which we may not have an easy way to think of how that happens, but we know that people that have trouble with sleep are more likely to get diabetes, more likely to get high blood pressure, more likely to get heart disease. There's a number of illnesses where there's that link, and sometimes it's hard to tell which came first.
Yes. So lack of sleep can affect heart or diabetes or blood pressure, and it can also affect their personal lifestyle and relationship as well. So it's very important to recognize it, that there is something which is affecting them. Does screen time, TV time, or like most of the people nowadays are on their smartphones before they go to sleep, does it affect the sleep?
Oh dear, now we're talking about a huge new challenge. I mean, if we didn't have a big problem, as a society we had all kinds of trouble with insomnia before screens, it would seem that screens and these individualized screens that we are taking to bed with us are having a huge impact. And I think that we're only starting to see the tip of the iceberg of how much this is impacting on health.
Yeah, so that can affect their sleep time and affect their...
So some people have already heard about the aspect of the type of light that's coming off the screen that can be interfering with our circadian rhythm. The rhythm that we're used to for sleep and wake is affected by light.
Right.
And so if we're using lights late at night and the wrong type of light, this can really throw off our bodies.
Yeah, that's very important actually. That's very interesting. We'll continue the discussion after taking a short break.
Thanks.
Please stay back for the next part. Welcome back to the show Talk with Your Doc. With us is Dr. Steve Klassen, and he is guiding us about sleep disorder called as insomnia. Dr. Klassen, you were mentioning about effect of LCD screen on the sleep, and it can lead to disturbance of sleep. Can it lead to insomnia, or there are many other factors beyond it, like alcohol or tea or coffee before going to the sleep?
Sure, and so absolutely that screens are affecting our ability to sleep. Screens are impacting on our sleep-wake cycles, and I think that the evidence is the more screens in the room, the more trouble we're having with insomnia. So ideally it's zero.
It should be pitch dark before you go to sleep.
Ideally it's zero screens, and probably zero screens from a certain hour at night. Whether, there's some studies saying, boy, if you can turn off your screens by 8 o'clock at night would be ideal. and how many people are doing that.
I wish.
So, but as you're describing, that there's a term called sleep hygiene, and there's so many other things that play into insomnia. So things like alcohol. There's a certain number of people that like to use alcohol as a way to try to get to sleep. Essentially, they're using it as a medication for sleep. And while for some people that does help them get to sleep, unfortunately, it seems to affect the actual quality of sleep. So in the long run, even though they've used alcohol to get to sleep and they feel that's been useful, in the end, they actually aren't getting as good a sleep, and it's been ended up being counterproductive. But
So
people have
one
been
should
used
not
to this
drink
sleep.
alcohol before going to the sleep.
Ideally, no alcohol before bed.
And how about tea or coffee?
Sure. I mean, caffeine, we can all know that
It's
caffeine is a
stimulant, right?
stimulant, and so
Yeah.
if you're having trouble with sleep, and I think another thing to remember is beyond tea and coffee, all the caffeinated drinks that are out
Smoking
there.
even.
Absolutely. But sticking with caffeine for a moment, whether it's hot chocolate or whether it's the various types of pop, and even clear pops can have caffeine in them, and sometimes people forget
Right,
that.
right. So the sleep hygiene includes not to have all the stimulant before going to the sleep?
Yeah, and just the same way that hygiene we use for other things, like whether dental hygiene, where we've got rituals or habits that help us take care of ourselves. Hygiene for sleep is a similar idea, that we get into some rituals, we get into some patterns that are positive, that are good for getting rest. So it's making sure that what we drink, when we eat, when we exercise, all these things impact on our sleep hygiene.
So what one should do to have a good night's sleep? So what is like a
What are some healthy habits?
healthy habits?
Yeah, and so there's no question that healthy sleep habits are useful. And one of the things I'll introduce already here is that for years we would, as doctors, try to promote sleep hygiene, healthy sleep habits as a solution for insomnia. And I'm already going to just touch on this, that while that's important, we haven't actually found that sleep hygiene has cured insomnia. So we're going to need to do something more about it. But in the meantime, it's important to take care of ourselves, that we're not exercising too late, that we're not having meals too late, that ideally it's a small meal for supper and not a lot of snacking
Right.
in the evening is ideal for better sleep at night.
So
And there's so many more things.
Having exercise late in the evening can also affect your health probably, and late night meal also can lead to insomnia. So are there any medications or prescribed drugs which are used in the treatment of insomnia?
Right. I mean, as we've talked, that there are medications that can cause trouble with insomnia, but then people look for pills. Often they come, if they haven't come to the doctor for pills, if they complain to the doctor about insomnia, so often the easiest thing to do is write a prescription.
Doctors write a prescription.
Yeah, and so there are medicines that are designed or marketed for helping with sleep.
Is it advisable or beneficial, or there are a lot of side effects with this?
Yeah, I mean, as we keep on, the evidence keeps on building with the common sense that this isn't working out very well, that sleep medications, while temporarily may overcome a little bit of sleep resistance, the ability to, they may help people get to sleep, but just like alcohol, they in the end affect the quality of sleep. So the rhythms of sleep, the phases of sleep get affected. So in the end, the person isn't getting as good a rest at the end of the night. Right. And so long-term use of medication, I don't think anybody promotes it, and yet so many people are hooked on these things.
And they get addicted to it, or they get tolerant to it, and they need the higher dose?
Sure. I mean, that's a common thing, that what worked initially stops working, and so then they either go to a higher dose or add yet another one. And I've seen people on multiple sleep medications and still complaining about their sleep, and yet they want yet another pill. So
sleep medications work for a short time, but not over the long time, probably.
I think that's a really important thing, that if we should use medications at all, they should be used for a short time.
Otherwise, they have a lot of side effects as well on the body.
Absolutely. So, what we see with many of the studies for medications for sleep is that while they may have that initial benefit, in the long term, they're doing more harm than good. So they're not only, you're not getting that quality of sleep, but now you're at more risk for falls, people are at more risk for drug interactions, people are more risk for being sedated, all kinds of things
Right.
that are happening from these medications.
Right. So, other than the medication, and first we talked about the good sleep hygiene, good sleep habits, but if they are not getting treated with that, they might receive some medication. But if medications are not working, what are the other options for the patients with insomnia?
Right. And so in the past, what doctors would do, it would be to focus on the sleep hygiene. They'd say, hey, what bad habits have you got around your sleep, and let's fix these, and then hopefully you'll sleep just fine. And that seemed to make sense until we eventually realized that just focusing on the sleep hygiene didn't seem to be enough.
Yes.
And so that's where we ended up falling back to pills. So people would try to do all these things and do all these good habits, and then when that didn't work, well, what else do we have? Then they went to pills. So fortunately, in the last few years, we finally realized that there are some effective treatments beyond medication.
What are those?
Yeah, so thanks for asking. So I think the one that's come to the mind the most is cognitive behavioral therapy for insomnia.
Cognitive behavioral therapy. So what is it?
So cognitive behavioral therapy looks at some of how we're thinking about sleep, what our beliefs around sleep are. And so often people have developed fearful thinking, they've developed some fearful beliefs around sleep or their lack of sleep, and these are really interfering with their sleep. And so this therapy helps you identify what are those fears, what are those beliefs that are interfering with your sleep, and allows you to actually take a look at that and potentially change the way you think.
So who gives this treatment?
Sure. So cognitive behavioral therapy is something that almost every therapist, almost any counselor is familiar with already. It's
family doctor?
And family doctors are often trained in this, and whether or not they feel comfortable to do the formal therapy or do a little bit of the interaction and then make the referral to a counselor. There's various approaches that family doctors might take.
So what is included in this cognitive behavioral therapy or CBT? Like you go to a specialist and you just talk, or what happens there?
Yeah, I mean, people can even do this on their own, and later I can show some of the books that are available right now to help with this, so a person can do some reading on their own and examine this on their own. Often it's great to have a coach, because sometimes we have our blind spots and we aren't challenging ourselves and we're on our beliefs just on our own, and so some talking it out can be really useful.
So you go to the family doctor, and then he refers to you to the CBT specialist?
Sure. So if the family doctor doesn't have the space or feel comfortable to do the CBT themselves, then they can refer to a counselor. And so there's counselors both private as well as in the public.
And they are like a specialist in sleep disorders, probably?
No, you don't have to be, right? I think that this is something that the CBT is something that almost every therapist is familiar with, and so they can help you explore these things.
Okay, we'll talk more about CBT after a short break. Please stay back for the last part. Thank you. Welcome back to the show, Talk with Your Doc. With us is Dr. Steve Klassen, and we are talking about a topic or disorder called as insomnia. Dr. Klassen, you were mentioning about cognitive behavioral therapy or CBT. So tell us about how CBT works.
Sure. So maybe a good way to go about this is to give an example of where things can go wrong in terms of our beliefs around sleep. So a common thing would happen is a person realizes that they're having trouble sleeping, and they look at the clock and they realize that, oh my goodness, it's 2 in the morning, and they start thinking, well, I'm only going to have so many hours till I have to wake up, and I won't be able to function, and if I can't function at my work, I've had some dispute with my boss, and am I going to lose my job? And if I lose my job, and we've just got this terrible spiral that develops.
Yes.
So often insomnia is made worse by anxiety. Okay. And so these beliefs that we have add to it, and you can imagine that those thoughts aren't going to help a person sleep.
Yes. So when they have this thought, then it aggravates their insomnia more and more, because now next day they go to work and then they are stressed out, and then next day go to sleep, and again the cycle continues. So what happens in the cognitive behavioral therapy?
Yeah, so I mean, an interesting example that I'll take, we could go take a number of those different thoughts, but why don't we take the looking at the clock. So by looking at the clock, oh, it's 2 o'clock, so now I try to sleep, and now I look at the clock again, how long has it been? And oh, it's 2:02. Right, and you know the hours can drag on, and a person can be what we call clock watching, and this is just amping up the now it's only when they figured they have to get up at 7, now it's 3 o'clock in the morning, and now I can only be able to get 4 hours of sleep, and you can imagine how this is spiraling, right? So in cognitive behavioral therapy, there's a couple components here. Do you really need to know what time it is when you're not sleeping? What good is this knowing what time it is?
Yes.
And so some people have this I need to know because I need to know how much sleep I had. But where's that belief coming from? Why do you need to know how many hours? Why do you need to calculate these things? Aren't these adding to your troubles? So if a person can learn to believe that actually seeing the clock is actually adding to their anxiety,
yes,
and that they can learn that they don't even want to know what time it is. So what I'll often encourage people to do is to take all the clocks out of the room, and if they can't take them all out of the room, at least to make them invisible. So putting a flap over them or doing something so that they can't see the time. And so that then when they do wake up or realize they're not sleeping, there's no ability to calculate. They don't know what time it is.
Yeah.
And so I'm in bed, it's time to rest. Even if I'm not sleeping, I can rest. And so now a new belief is there. I don't need to know what time it is. In fact, if I know what time it is, then I'm just going to worry about that. So I'm glad I don't know the time.
So they remove the timing in the CBT, remove the fear from the mind that you have a lack of sleep. And along with that, what other things are included in the CBT, like mindfulness or?
Sure. And so mindfulness is another technique that one can learn on one's own, and I'm glad you brought up mindfulness. So mindfulness ties into CBT very well, but it is something in itself that a person can learn mindfulness from books, from videos. You just go on YouTube and type in mindfulness for insomnia, and quickly a person can find.
So what it is exactly?
Yeah, and I think what mindfulness is just being aware of your thought processes. It's being aware that, oh, I'm thinking, and so in a sense it's thinking about thinking, being aware about thinking, and being able to just step back from yourself and say, do I want to think that? Do I want to go down that path? And there's a great release when you realize that, I've got some ability to affect this.
So it's like self-hypnosis or giving suggestions to yourself and relaxing yourself a little bit?
That can be part of it.
Yeah.
And when we come to mindfulness, often when you get coached, it just be encouraged to say, what are you thinking? And can you let that thought go
away?
Yeah.
What about the relaxation therapy before the sleep?
Right. And so relaxation therapy, again, is something that a person can read about and practice in their own mind, or they can get some guided meditations, guided relaxation, which many people can attest that these can be useful instead of using medications.
Would you recommend any books or any resources for the people to know more about cognitive behavioral therapy and mindfulness, relaxation, and how do they get more guidance about it?
Right. And so, I'll share a couple books here today, but, you certainly don't need to write these down because there's so many good resources. They're very similar in terms of the concepts, and so different styles will work for different people. And so a book that I brought along with me today was by Colleen Carney and Rachel Manver. And this is specifically about cognitive behavioral therapy for insomnia. Something that's quite accessible. It's an easy read, and this is where you can start doing your own CBT for insomnia. And if you're finding that, hey, I want to explore this further, a professional can help you with coaching you with it.
How about this other book you brought today?
Right, and so this is a workbook that by the same authors that may be a little bit easier to see on the screen, and so a couple resources that are there. But these are by no means the only ones that I'd suggest.
Yeah, so they get the book, they read the books, but they approach their family doctor as well and get more treatment options available.
Another good specialist in town that many people recognize the name Dr. Holtby, who I think he's recently retired, but he taught me about a lot about insomnia, and he's done a lot of work in areas like sleep apnea, and he recommends a book called No More Sleepless Nights, and that's another good resource that I often recommend.
Now, some people have difficulty in going to the sleep, but some people have too much sleep. So what do you say about them?
Sure. You know, that's an interesting thing. It's not all that. That's much less common than a person is getting too much sleep. And I think that when a person is noticing that, I'm feeling tired all the time and I feel like I need to sleep all the time, I think that's a sign that something's not right, and that time to figure that out as well.
But some people might naturally need more than 8 hours of sleep. Probably.
Yeah, I think that sometimes what happens is that people say that, you know, hey, I'm somebody who needs 10 hours of sleep and they feel like they're sleeping too much. That may not be. If a person is getting rested by that time and able to function, that's where I'm not all that worried about an exact time. I think there's a lot of individuality.
Thank you, Dr. Klassen, for coming to the show and guiding us about this disorder. Thank you so much.
Thank you.
Thank you everyone for being part of the show.